Hi Claire, just one final question from us today. At Mummy Star, we offer emotional support to women and families, but we are not trained counsellors. When does someone move from needing emotional support from us or friends or family or peers to needing professional help from a counsellor like yourself? And are there any signs to recognise and things that people could be aware of?
I think low mood is if somebody is continuously at a low mood, I think it might be do you feel that you need to speak to a professional? Have you visited your GP? With regards to your low mood, they may have visited regarding their cancer. Are they checking in on their mental health? Because there's a huge impact on mental health, as you know, around a diagnosis, and especially in these circumstances that your wonderful charities, support. And so I think definitely, maybe looking if somebody's irritable, are they feeling, discontent? Are their moods low all the time? Maybe they can't think properly. And simply asking them, are you okay? There's measures that you can do as well. You could say, if we measured from 1 to 8 or 1 to 5, 1 being very low and 5 being great, where are you in that scale? And they're really simple scales that you can kind of use, and you can keep an eye on. And it may be every time you speak to them or see them, just on that scale of 1 to 10, how are you feeling? And if you keep a little note of it, or kind of, well, last time I spoke to you, you was a 8 and now you're a 3. You know that their moods are dipping. You know that they're kind of they're going down. And another good way is mental health first aiders as well within the teams as well, because they teach you to look out for these signs and what signs to look out for. And generally it's low mood, changing personalities that you pick up on, and you get to know your ladies or or families, and you'll understand. You might see that, oh, you don't look so great today, or something bothering you, kind of thing. Just checking in with them. I think people never really know, do they, when they need help? And I think so. Just kind of looking for those kind of areas, really.
I mean, if I can maybe just come in on that, Claire, and I think that's the difficulty, isn't it, for professionals and for us, because we're not trained counsellors, we're not experts in mental health. So there's a little bit we can do in trying to recognise, but I think for a lot of our women that we support, they don't know, they're kind of thinking, how can I decide, is this, do I need to reach out and get that professional help? Because sometimes that's difficult to access. Sometimes it is about admitting that perhaps that you do need that extra support. And for many of our families that going through treatment or coming to the end of it, they've often got something else going on, whether that be young babies, like you say, during the pregnancy, whether they've suffered baby loss. They've got all these things, and I guess they would be looking at how can they recognize it in themselves, maybe, when this, what can be seen as normal anxiety, is actually changing to, like you say, that more more difficulties with mental health. So is there anything that we can kind of say to our family, our mums, that they can look at themselves to see if they need extra support?
Yeah, I mean, I don't know if you've got kind of like some leaflets maybe made up, check in with your mental health, or you've got your own language in your own charities, and maybe there's just a few ticks that they check. It might be 5 questions or something, that they can ask themselves. Am I feeling low mood? Am I feeling irritable on a scale of 1 to 5? Am I feeling irritable on a scale of 1 to 5? we use in the profession, we have a general anxiety and patient health questionnaire that we use, medically used, you can find them on the internet, and you have training in it, and you can ask these questions. You wouldn't expect somebody to do it. You can do them yourself, but you can get a score in if you want to do that, or it might just be that simple leaflet just to ask yourself 5 questions and check in. And if you're on a low scale, then you kind of know that you need help. If you're on a higher scale, then you think, oh, I'm okay, but I'm all right with the support that I'm getting from the charity.
So I guess it is about maybe, saying to our families, if they have got any concerns about their low mood or how they're feeling, how, their anxieties may be just, not getting any better, or in fact getting worse, that they should reach out and speak, whether that be their GP, whether it be a health visitor if they're in contact with them, whether it be, the specialist nurse. So anybody, to reach out and ask what help's available.
Absolutely. And they're prenatal, their natal classes as well. There might be somebody there that they can speak to, or like you say, their health visitors is a really good one. My health visitor picked up that I have postnatal depression many years. My daughter's still a lot older now, but I would never have known. She just said, can you answer these questions for me? And I answered them. She said, on a scale from 1 to 10, and I answered, and she read it, and she said, no, you have severe postnatal depression. But I would never have known. I just said, oh, I'm just not feeling right, I just feel low. And so she picked that up. So it is professional advice, but also I think you offer emotional support to people that attend to your charity. So there are things that you can kind of maybe where that emotional support is, they could ask them those quick 5 questions, even just to kind of monitor them, and then offer, have you spoken to somebody? Because sometimes they wouldn't even know to say that to their health visitors. They might just think it's normal that their mood is low, and so rightly, that it should be a time of enjoyment and a fun time. And sadly, sometimes these things aren't, are they? And so they might not realise that that's what's happening. They might think it's normal to,
I think this is one of the biggest challenges, I think, within the area that we work in, is for many families, it's trying to separate what potentially is being caused by their cancer diagnosis or ongoing appointments and treatments and that whole whirlwind that they get drawn into. And then there's also just the baby related, pregnancy related emotions. So you could have a family who, will suffer from postnatal depression anyway, irrespective of the cancer diagnosis. But when you're in the midst of that turmoil, it's very difficult to separate which part of this is to do with my cancer and the uncertainty that I'm trying to juggle, as opposed to what of this is baby blues that suddenly there's then continued to develop into postnatal depression, or the sort of the more extreme ends of sort of postpartum mental health. But I guess one of the things that we reiterate when we're talking to other health professionals is the importance of, in these cases, getting that perinatal planning done as early as possible, so that it offsets and there's more of a plan, rather than it needing to be reactive when that particular family end up in a crisis situation around mental health. That we can see that there are potential red flags that could cause somebody to sort of shift into a postnatal depression space, because maternity is so upended because of the diagnosis and because of treatment, and that I suppose what we perhaps take for granted in looking forward to maternity time is suddenly sort of interrupted and interspersed with appointments and everything to do with cancer, rather than that maternity leave, if you like, being enjoyable and being something to relax into, as obviously as tiring as it is, mixed with enjoyment. It can be quite a blurred area to really sort of differentiate one thing from another.
Absolutely, and I totally agree with you. It's kind of trying to find it, you know, like pick it up in the beginning, as opposed to, like you say, at the end in crisis, where they've had the baby and they end up ruminating, and because they just can't cope with their emotions. Their hormones are all over the place anyway, having a baby. So that first week, I remember when I had a baby, I just cried. And they were saying to me, "Why are you crying?" And I went, "I don't know. I just, you know," and I didn't have those other things to juggle with in my mind. And it's about picking it up early, because if you know, imagine being 3, 4, 5, 6 months pregnant, and all of a sudden you're hit with a diagnosis of cancer. There's all sorts of things going in the baby, you know, survival, you know, everything, isn't it? Your maternal instincts, your hormones, everything is changing with pregnancy, let alone your hormones changing with cancer, because your hormones change too, depending on what cancer you've got. There's an awful lot there to factor in about their thoughts and their feelings. It's really, for me, I feel really person-centered about it, that person-centered approach, their thoughts, their feelings, how they're behaving, you know, what they're finding difficult, what they're finding hard to come to terms with, really get into the center of their emotions, if they allow you.
Yeah, and that's key. I think you know, I suppose somebody has to want and be, you know, be willing to accept support. Sometimes you can't force it upon somebody, otherwise it ends up, you know, being potentially rejected or
Yeah.
you know, not received in the right space.
Yeah, absolutely.
Okay, well, Claire, sorry, Tracy, go on.
I was just going to say, when Claire touched on earlier, when we talked about, you know, when is the right time for counselling, you know, is there a right time? And actually Claire said no, because it's totally individual. And it you know, if somebody is kind of pushed into accepting counselling that might not be at the right time for them, or with the right person, or in the right circumstances, I think maybe that's, you know, can be difficult for people in that circumstance, but also, you know, hopefully that won't kind of put them off maybe in 3 or 4 months down the line thinking, actually, I wasn't ready, but I am now, and having another kind of, you know, going back and saying, I wasn't ready, you know, can I access support now? And there's nothing wrong with that.
Yeah, and maybe letting them know that, you know, this support is here for you when you choose, you know, when you feel ready. Or if you feel ready, then there, you know, we can find support for it. We can help you to find support, or point you and signpost them into the right direction, like you say, the health visitors or their oncology nurses, or, you know, or doctors. And it's just about being, you know, for us being aware, and for them knowing that you're there.
Yeah, absolutely. Okay, I'm going to bring the recorded session to a close. So, Claire, just a thank you from the team at Movistar for giving you time today to do this session for us. Obviously, this will be recorded and the clips will be available on our website within the next 10 days. So, yeah, thank you for coming on, and I'm going to sort of stop recording now.